Welcome to the Parents for Public School 2020 annual meeting. This is the first year we've done this remotely, and we're really happy to have all of you joining us from across the islands, and we're really thrilled to have a really exciting and diverse group of panelists to talk about the current state of public education in Hawaii today under very unique and very trying times. My name is Claire Hannes. I'm a board member. I'm a parent of a Kaiser High School senior and who's gone through all the way through public school in Hawaii, and a recent Kaiser graduate who also went through pretty much K through 12 in the public schools. And let me just give an overview of the agenda today. And then we'll dive into the content. So we are going to have results of the survey that Parents for Public Schools Hawaii recently conducted, where we had we had 585 families respond to the survey. So Lois Yamauchi will present the results of the survey, and then the guest speakers will discuss some of the survey results in their comments, and they're really representing a diverse interests and expertise, but all with a concern for Hawaii's kids. After I give an introduction of the speakers, we'll have Lieutenant Governor Josh Green speak first, because he has other duties that he has to get to this morning. So he's going to need to leave us at 9:45. So Josh will speak for about 10 minutes, and then we'll have a brief Q&A of Josh, and then followed by Margary Martin, Reid, Kuba, and Deborah Bond-Upson. And I'll give brief bios on all of them in a minute. Then we'll have a Q&A of the remaining three panelists, and we ask that you put your questions in the chat. And if you would like to direct them to anyone in particular, please do that. Then after that, we will have a brief overview at the end of our 2-hour session of Parents for Public Schools Hawaii, our history and our mission and our hopes for the future. So without further ado, let me introduce Lois Yamauchi, who is our board president, to present the results of our survey. Lois.
Okay, thank you, Claire. Hello, everyone, and good morning. Thank you for coming. My name is Lois Yamauchi, and I'm the president of Parents for Public Schools of Hawaii. I'm going to be giving a brief overview of the recent survey we did of families regarding their thoughts on school reopening. And the family members had this 2-week window in August and September to respond, and the responses were online. We had 585 families responding and representing over 1,000 students in these grade levels, as you can see there. We also had represented 11% of students in special education, 7% who spoke a language other than English. And we had we had PPS members responding, as well as others who became members. So it's a kind of a broad survey of folks across the islands. You'll see here who was represented. Maui district, it represents Maui, Molokai, and Lanai. And then Honolulu was, after Maui, was the second largest group represented. The survey asked respondents about their concerns, how concerned they were about 11 issues. And these issues came from a previous survey that we did at the end of the last school year. And we asked people to rate if they were concerned or not concerned about various issues. We also asked them to tell us about their, how they received information about the schools. Oops, sorry. How because we found that in our last survey, there was some confusion. Families didn't feel, some of the families were confused about where to get information. Things were happening so quickly. So that's what we wanted to know, is where are you getting the information? And lastly, we asked people with an open-ended question to respond, let us know what concerns they had in general. So these are the 5 top concerns that people rated. And I should say that the numbers were actually very close. So even though like number 1 is children's social and emotional needs, it was number 2 is also very important to people. So in addition to social and emotional needs, people were concerned that their children aren't going to learn what they're supposed to be learning this year. They were very concerned about health and safety of the teachers and staff who are now on campus and working together. Families were concerned about motivating their children during virtual learning, and children's health and safety once they return to school, or some children are actually in school right now. Although 39 respondents were urging the schools to reopen, and this is particularly for the neighbor islands where we do note that the COVID rates are much lower than on Oahu, most respondents did not feel it was safe to reopen schools face-to-face. And I'm now talking about the open-ended comments. People commented on the shortcomings. Even though they appreciated that their children were at home, they also recognized some shortcomings of distance learning. For example, many people responded about the challenges they were finding teaching and supervising their children while they were working at home. And this was an issue especially for people who had multiple children at home. There was a number of criticisms of the Acellus learning online program, and this might have been because during the time that we were doing the survey, there were things in the newspaper about this program. And families in general felt their children were spending so much time in front of a screen that they were very concerned about that. The respondents noted teaching inconsistencies across within the same school and the same complexes. So as you know, people in Hawaii talk to their neighbors and their friends and relatives, and so they were comparing what their kids were doing to what others were doing within the same school. People praised the teachers and the administrators for doing a good job, and then others were more critical. Some of their respondents felt that the teachers did not have enough preparation for distance learning, and they criticized the instruction that they observed their children engaged in. We're coming back to the social emotional needs. So also in the open-ended comments, people noted that their children, both elementary school learners as well as high schoolers, were challenged by being isolated from their peers and their teachers. When we asked about the ways that people communicated with or received information from their schools, these were the top 3 ways that they reported. First off, they said that they received emails and text messages from their school directly. Families also consulted the school websites, and they received information directly from their children's teachers through emails and text messages. Okay, that was a really quick update brief update on the survey. You can go to our website where we'll be posting the survey in its full form, so you can read the whole report. And I'm really excited to hear from our panelists as they address the concerns noted by our respondents. Thank you very much.
Great. Thank you very much, Lois. And I'd also like to recognize the work of Deborah Bond-Upson and other of our board members who really spearheaded the survey and getting it out. And thank you to all of you statewide who participated in the survey. I'm just going to go through now introductions of our speakers, brief bios. There's lots more that can be said about all of these really amazing people, but we'll go through the bios and then we'll first hear from Lieutenant Governor Josh Green. So Josh is a local doctor, husband, and father of two school-age children, Maya and Sam. One of them is currently in public school, and Josh is a product of public schools. After completing his medical training, he joined the National Health Corps and started his life's work as a family physician and ER doctor in hospitals and clinics on the Big Island. He served in the Hawaii State House of Representatives from 2004 to 2008, and in the Hawaii State Senate from 2008 until 2018, where he chaired the Health Committee and Human Services Committee. He's also been one of the state's most outspoken officials leading the coronavirus response. After Josh speaks, we're going to hear from Margary Martin. Margary is an associate professor in the School of Education at the University of Hawaii at Hilo, and she specializes in socio-emotional learning and immigrant studies. She received her PhD in teaching and learning from New York University, where she was also the director of immigration studies. Prior to her appointment at UH Hilo, she was a visiting professor at Brown University and a research fellow and principal data analyst at UCLA's National Commission on Asian American and Pacific Islanders. Margary has a master's degree and has taught secondary language arts and social studies. Our third panelist will be Reid Kuba, who's the principal at Jarrett Middle School, which is a small middle school in Pololo that serves families from culturally diverse and low-income backgrounds. Under Reid's leadership, Jarrett has become a model middle school, exemplifying high achievement and well-rounded education. Prior to becoming a principal at Jarrett, Reid was a principal at Pololo Elementary School, a vice principal at Kalani High School, and an elementary school teacher. He and his wife, who's also a teacher, have 3 daughters. He received his PhD in education from the University of Hawaii, and his dissertation focused on beliefs and qualities of families from low socioeconomic backgrounds that fostered student success. And our last panelist is our board member, Deborah Bond-Upson, who has been a lifelong public education advocate. She has led organizations developing and delivering learning state and district level solutions, including hands-on, online, story-driven, media-rich, project-based learning, teacher professional development, assessment, and open education resource programs. The mother of 4 public school graduates, she's a founding board member of PPS Hawaii, is active in HE'e and the Hawaii Broadband Hui Declaration of Digital Rights effort. So thank you again to all of our panelists. And now, Josh Green, our first panelist. Josh, we wondered if you could address how we can keep our children as well as our teachers and staff safe in a school environment. How can we as parents and caregivers best stay informed of state and county directives? And what about the determination to reopen or resume in-person learning, either full in-person learning or as a hybrid model? Thank you, Josh.
Thank you very much. Thank you for having me, guys. I'll dive right in. There's so much to share. So I'm going to go through those questions and give a brief update where we are for perspective. And I think your poll or sample study was very good. It helps frame the obvious questions. How can we achieve safety? What are the impacts of isolation? How can our kids get adequate education given the extreme circumstances? And we will be okay, of course. The coronavirus crisis, the pandemic, is going to slow down or go away at some point. That's not saying a lot, but we will have a vaccine and we have to make sure it's a safe one, and some people will not want it. Some people will, and we will deal with all those things. So I'll touch on those. But you're absolutely right to focus on the points that you do focus on. That I have no doubt that we're framing the discussion in the right way. So first off, the most basics, and then so we have that in case I go on and on. The way to keep ourselves safe, absolutely, clearly, without any question at all, is good mask wearing. Very, very serious quality mask wearing on the part of our keiki, if they can, if it's appropriate per age, and their educators and the staff. If you want to do in-person learning, that is necessary. You have to have social distancing, which is difficult with young people. You have to have mask wearing if you want to not spread it. The masks are about 98.5% successful if both individuals, both parties are wearing a mask, even if someone's positive. I've had COVID now. I caught it in a car in a 70-minute ride from Kona Airport up to Hawai'i. Mask wearing, unfortunately, but not completely, because we were sipping Starbucks, and one of the gentlemen in the car was very sick, it turned out, and was coughing a lot. We didn't know he had COVID, but live and learn, okay? And we were in the car together, and that's how I caught it. Absolutely, I know that because I was tested negative beforehand, and I had no other contacts, so we know that. Now, if we do that, if we do mask wearing and social distancing and are smart about things, and in our schools, when we open, whenever that is, for in-person learning, we have to be very protective of our processes, meaning we have to be able to allow teachers or students to not go to school if they're feeling sick at all, and allow them to get tested, or enable them, empower them to get a COVID test and get ruled out before they go back into work or school. We have to contact trace immediately within 24 to 48 hours if anyone in our classrooms gets COVID. That doesn't mean no one will catch it. It means we will not have outbreaks. And that is the way to do it, and it works. It worked in my team's case completely. The moment that one of the guys tested positive, I locked it down, got tested an hour later, and went into lockdown. And when I got my result, I was in for the full quarantine, which, by the way, is 10 days from symptom onset, 14 days for close contacts, just so people know and hear it. I know it gets confusing. We can talk about that. But that's the way you do it. If you want to stop COVID and open up society, schools, economies, you can do it safely that way, with the caveat that you have to do a decent job. And if we're doing a crummy job, if the resources are not there, then it won't work as well. And that's what creates fear and obvious, regular, smart people concern, which is you guys. Okay, so that's the first part. Let me talk about the prevalence of the disease and where we are as a state, okay? COVID, we had two crises. The first phase of the pandemic, we did great. We had basically, for argument's sake, almost no cases compared to everywhere else in the world up through July 4th. Because we had a full lockdown, no one was traveling here, we had okay mask wearing, and we had a stay-at-home order. So if you really want to not have any COVID, stay-at-home order is the only way to have no COVID. But you can have very little COVID spreading around if you do the other things I described. We're now up to 400 contact tracers, and we have enough tests to get around, so we can do it. So up through July 4th, very few cases, very little spread, almost no hospitalizations. And then after July 4th, with the Kama'aina opening of the economy, people being out, not full mask wearing, lots of parties, it skyrocketed, and we then had 10,000 cases. We then also had 11% of our people end up in the hospital for the first month and a half. The number dropped a little bit because we began to have more people that were younger that were catching COVID, and the hospital rate is about 5% for younger people and about 11% for older people. And then a gray area in the middle for people like me. I'm 50, okay, right smack dab in the middle of this thing. The people that pass away are almost always people who are older, but not always. We had a 20-year-old and a 36-year-old pass away, and I had a 51-year-old friend die. So it can absolutely happen even to people who are well, but 90+% of the individuals who will get very sick will be over 65 years old with other chronic health problems. So that's something to reassure parents and students, but it only goes so far because we all are human. Another thing to reassure people is that as of today, we've had 12,000 cases total, 12,600 cases. We've had 142 fatalities. So that's about 1% of our population has been positive at some point for the state, for immunity's sake. We don't have much immunity. Currently, the prevalence of the disease is 2,070 people out of 1.4 million people in our state. That means 1 out of 700 individuals have confirmed active COVID and they're at home, which is a very small number. Now, there are other people out there, of course, that have COVID and that didn't get tested or asymptomatic, but not a lot. Now that we've done a lot of background testing, we know the rate is around 1 out of 200 people when we did the surge testing. So for the purposes of people gauging risk for their self, for their children going back to school, the prevalence is very low right now. So I want to give people that perspective so that you know what your actual risk is, which means if people are actually wearing masks and the prevalence remains around this rate, around 1 out of 700 people, or maybe 1 out of 500 people, it should not be a threat if we do a good job. Now, of course, if we get a big burst in our among our keiki and start spreading, it's a problem. If we get a big burst from the opening of tourism, which I'm going to talk about in about a half second, as we care for people and give services, it's a problem. Once again, mitigated by contact tracing and testing. That's the way you do it. Let's talk a little bit about the immediate future, okay? So today we had 133 cases. That will be reported on the news soon. So we've been hovering between 80 and 130 is about where we've been. The average has been 100 cases per day for the last 2 weeks. So it's been fairly steady. We are planning, and I know this scares people, but it should not, in my opinion, scare people as we open up for tourism with a pretest. The rate of people traveling to Hawaii with a pretest and having COVID will be lower than our current prevalence rate in Hawaii, lower, which means it's less than 1 out of 700 people will come here and they will be asymptomatic travelers. Now we will have more business. That means hotels will start opening and people will be going to work, and they'll have to do a good job not spreading COVID if they happen to be asymptomatic spreaders or in the lunchroom or whatever. But at some point we're going to have to just realize that until we get to a vaccination, it'll be really hard to knock it out. Masks are more valuable than vaccination, just so you know. And so I wanted to give that overview and that shape of where we are. Now, there's a lot to discuss, obviously, and I'll stop here in a second so people can ask me specific questions, but I'll just address the reality of the vaccine. I'm actually going to be hosting, I believe on the 7th, Dr. Fauci in a discussion, and I'll ask a lot of questions of him on a live telecast at 7 in the morning, I believe, I think on the 7th. But let me just say this. A vaccination will come, but they're racing it. We have to assess it very carefully for a lot of reasons. One, it has to be safe. Two, we don't want it to discourage regular vaccinations if that's a part of their lives. I know some people don't believe in vaccinations. That's their prerogative. I don't press people, okay? I do believe in them, but I understand people have to make a decision. This one is coming on quickly though, and so we really have to make a decision. By the end of the year, I will likely be able to vaccinate about 10% of our population, mostly high-risk people, probably kupuna, so they don't die from it if they catch COVID. And later in the year, sometime by spring, we hope to get as many people vaccinated as we'd like. And that's a big plan that we're putting together. We'll have that finalized sometime mid-October. So that's a lot to absorb, okay, I know. And I will just say this in closing. Our hospital numbers now are at lows that they have been for the last 2 months. We're down at 125 people in the hospital, peaked at 318. Our rate is around 100. We peaked at an average of 270 per day. We're doing a good job. People are sacrificing. I now worry much more about the isolation and stopping society in its tracks, and the fact that some people are facing very serious economic hardship, but also the developmental questions for young kids, even adolescents, and frankly, even adults who are having to change the way they socialize will become consequential if we don't begin to normalize some of our behaviors. And so I know it's not real normal wearing a mask and a face guard and doing all those things, but it's a lot more normal than being holed up at home and never seeing anybody. So I will talk about all these questions. I see someone popped in, will teachers be in the high-risk category? I did recommend that, because anyone who's front-facing society, especially if they meet any criteria at all, they're a little older or they have a chronic health illness, a chronic health consequence to deal with, yes, I want all those categories to be respected, so that if a teacher wanted to be out there teaching students and wanted a vaccination, they could do it. So I'll stop there and just thank you so much for welcoming me. And I'm sorry I don't get the full 2 hours, but it's unusually busy for me this year.
We understand, Josh, and we are truly appreciative of the time that you're giving us this morning. So thank you. We do have a number of other questions that have come in, and I'm just going to take them in the order received. So Joseph asked, Dr. Green said 10-day from contact, and I believe he's talking about the quarantine period and then 14 days. He said it very fast. Could that be repeated? Could he also comment on open air versus closed air rooms? And Joseph also asked if the video is available online. He can later rewatch it, and it will be available online. So
Yeah,
Josh.
I was born in New York, so I still talk too fast. I'm sorry about that. But yes, okay. That's a very interesting thing. So here's the deal on getting released from having COVID or contact, okay? CDC rules. If you catch COVID and you get tested on whatever day you get tested, the rules are you now look at yourself, you say, okay, when did you actually have any symptoms? If you were asymptomatic, it's from your test date. If you had symptoms, in my case, I got tested on a Friday, but I reflected on things and I was very fatigued on Wednesday. Fatigued, feeling a little achy. Once we did that and I talked with the health professionals, even though I am a health professional, I relied on them so that I wasn't biased. They said, okay, your symptoms began technically on Wednesday. 10 days from that Wednesday, if you are asymptomatic, no fever, no significant symptoms, you get released. I took an extra week anyway because obviously I'm a little bit too out there, okay? So that's the first rule, 10 days from symptoms. If you have severe symptoms, for example, if you end up in the hospital like President, okay, it's 20 days from your first symptoms, 20 days in order to be out of the transmission zone from being infectious. That's the first piece, okay? So 10 days mild case, 20 days severe case till you're released. And we have 2,000 people left that are not released yet, okay? Now, if you are Jamie, my wife, okay? She was last in touch, in direct contact with me that Friday morning. If you are in direct contact with someone who's COVID positive, you have to, and a direct contact means that, close contact actually is the word, within 6 feet and for 15 minutes or more, then you are a close contact. You need to be tested 5 days after that contact for best effect, and you need to quarantine for 14 days. So my family, Sammy, Maya, and Jamie, had to quarantine for 14 days in the house. They all tested negative, 14 days after that last time they were with me. Ironically, that meant that I cleared almost a week before them, but I stayed with them because I'm their family, okay? So that's how it goes. Now, there was a second part of that question, I think.
Could you comment on open air versus closed air classrooms?
Yes. Okay. What I can comment on is, and it should translate very well. Open air restaurants. I read studies on this. Open air restaurants versus closed air restaurants, which is, for argument's sake, similar because it's an hour or more in a contained space or in an open space with people that you're worried could spread it to you, right? Not a perfect analogy, but very close. And the bad news is closed spaces are way worse, way worse. In the study, people were 19 times more likely to catch COVID by having an hour or more in a closed restaurant than in an open restaurant with the same people. So 19 times more risky by having that closed air that's just circulating, and you're within, usually you're probably having a more difficult time distancing and you don't have air being blown through. So if classrooms can do open air class, it is far better. They should definitely open the windows no matter what. If people can put up tents or pavilions or spread out their schedule that way, way better.
Thank you. A question from Rita. What is the percentage, and I'm not sure exactly what percentage she's talking about, but when we're living in a hotspot, like, and then she gives the Waianae zip code 96792, our risk percent then increases.
It does. So in some places, so the number I gave you was the statewide prevalence rate, right? And it can increase for sure. It could be twice as high in some zip codes and twice lower in other zip codes. It's a bell curve though, just so everyone knows, okay? The first standard deviation, 95% of the prevalence rate falls in with one standard deviation, and then 98.5% in two standard deviations, and so on. So for the worst outlier groups, it could be a lot higher. I will tell you this, for instance, the worst we ever had was at the peak of the outbreak in the state of Hawaii, in Kalihi, in and among the Pacific Islander community, we had a day where it was 51% of the people tested in that cohort were positive, as opposed to what has instead been really low. I mean, it's the positivity rate for most of this testing period has been around 1%. It has lately been closer to 5%, 3 to 5% actually. But the prevalence rate, sure, in some small parts of the community and definitely among Pacific Islanders, well, I would say Hawaii and Pacific Islander communities, but mostly Pacific Islanders, was a lot higher for a while.
Okay, thank you. Another question, given young children's unlikely successful masking, will they not present a serious threat to teacher health?
They will definitely present higher risk, no question. A couple things. This is where I come in on this as a doc. Okay, so no matter what, the teachers have to wear masks. If they can't wear masks because they have a chronic issue, they have to be allowed to teach from a distance. Period. Okay, it's just not fair to them. Will children spread it? They can. Now their prevalence rate is still very low, and so it's a very low prevalence. If the students themselves are instructed without question that they have to stay more than 6 feet away from their teachers, it will be fine. They'll be basically safe because the teachers will be wearing a mask. Teachers can even double mask, which makes it even like if a teacher is wearing an N95, which was not the recommendation for quite a long time because we were saving the N95s for people working in like the intensive care unit at the hospital where people were actually caring for known COVID cases, then you didn't get as much protection. And this kind of mask, these cloth masks are good. They don't do as much. I mean, if you bolster the mask with an additional filter, if you get yourself a filtered mask, it would be wise. If you can get your hands on an N95, it's great, but that really is too much to ask of someone for an 8-hour day. It's just not fair. You can't function that way. That's why we have to be understanding of teachers, giving them lots of breaks and time off, and we have to make sure that if they have a reason to be at a higher risk, they should be allowed to do distance teaching.
Thank you. With the politicization of the FDA/CDC, how can we be confident that the vaccine or that a future vaccine will be tested rigorously and will be safe and effective?
We can't be at the moment. I have that exact same concern. So I will be joining New York State in a secondary assessment of the vaccinations. And I'm going to make a point of getting a whole independent, non-political assessment of vaccinations. Because the last thing I want to do is I hope to be governor someday, even though who knows, who cares. But, I don't want to kill a bunch of people with a vaccine. There's no way on earth. So we have to do it safely. So that is going to be very important to me. We have to probably wait an additional 30 days, unfortunately, because it's not the nicest thing to say, but if we see what the rest of the world's experience with the vaccination is, we will know whether or not there's a problem. So I think people should be given total flexibility on whether or not they want to take the vaccine, and I respect them if they don't. But we will only get modest protection if we get, say, 40 or 50% adherence to a vaccination plan. Still, as long as the vaccine's pretty good and safe, and we get it into these high-risk groups, kupuna who are in nursing homes, nursing home workers, so that they can't spread it to our kupuna, first responders, and those who are seeing a lot of people, maybe that would include teachers, like hundreds of people per day because they're students, we will really decrease the rate of spread. I mean, seriously decrease it.
Thank you. Okay, another question, and there's lots of them. What are the plans to disperse CARES Act funding to supplement the cuts in education and the vulnerabilities of public education under COVID?
So we need to use CARES money for distance learning apparatus, in my opinion. We have to give every last student, teacher, school, whatever tech they need. That's one thing. And there may still be some residual CARES money going on for a long time because, needless to say, the election will matter. I'm not going to get political here today. Of course, I respect each political ideology, but there could be a lot more resources depending on who is chosen going forward. And so that's important. We could get another basic expenditure or appropriation. The additional part is mostly unemployment, giving people rent subsidies and unemployment subsidies. That's the primary place, just so that people can survive if they decide they have to not teach this semester, which I've heard from a lot of my friends who are teachers. They just couldn't do it because they've got children of their own. They can't go in. And that could, of course, become more significant problem. If, for example, let's just say theoretically we don't go full on in school learning or in-person learning in the fall, but that finally after January 1, everyone decides all schools are going to be open. Theoretically, okay, let's say that happens. Still, 20% of teachers might decide can't do it. This is the stories I hear, right? My mother-in-law has COPD. If I catch it from my class, I'm going to kill her. Or I have asthma. Or one of my 3 children had reactive lung disease. I can't do it. So some won't be able to go. So we have to support them with unemployment and support until they get a vaccination and feel ready to go, or till the rate is way down.
Great, thank you. And this next question kind of dovetails on that. Is there any consideration for mandatory sick days for all workers to ensure that people don't go to work sick and can stay home if their children are sick?
I haven't heard that, but I would absolutely support it. Mandatory approval of sick days, yes. And I don't think that there's any question that we'll get that approved. I think that that is an easy sell because there's right now a pretty tough dynamic going on between, and it always happens this way, the superintendent of schools and the teachers union and just regular smart teachers and parents. So my feeling is we should be totally accommodating and not hold it against anyone if they need to take sick days or their children have to take sick days from school. In fact, it's in our public health interest to do that because you always want to be able to rule out COVID with any symptoms, because otherwise you spread it to 30 other people and then you will actually be out and everyone will be sick.
Thank you. Okay, and a few more questions, and I understand you only have a few more minutes. So the next question is, why can't the government train and license more childcare providers and organize learning pods to minimize risks?
I'm sure we can and should. It's just a lot of work and lift. I think just someone has to step into the fray and do the work. And proposing that and using CARES money makes total sense to me. So if it's just like everything else, it's in this circumstance, it's a challenge because it's so much intense work, probably for a one-off experience, which is lasting a year or a year and a half. So we just have to get through this. The goal is to get through this with minimal additional spread and certainly minimal additional mortality or deaths until we get to the vaccination. And then most of these questions are then, okay. Most of these issues for 80% of the conversation we're having go out the window because we're safer then. We go to a tipping point.
Okay, thank you. And then how can you condone and promote a one-test system to exempt visitors from quarantine when healthcare professionals throughout the state are warning that community spread will escalate exponentially just as we are opening many school campuses for students to gather? We know that it will be extremely difficult to maintain social distancing, and there are no inspection protocols in place to evaluate our indoor spaces and campuses and check for acceptable ventilation and filtration.
So that person is conflating 2 different problems, okay? Let's be very clear. One is that you got the schools, and yes, we have to do everything right at the schools, no question. They're wrong, and they're buying into the BS that's being put out there about the pre-arrival testing program. You guys have to look at it analytically, okay? Right now, the rate of a person out there is about 1 out of 300 on the mainland that could be positive with COVID that hasn't had a test. If they had a test, it's 40,000 to 50,000 people per day testing positive. If they've had a test, that's positive, they can't come to Hawaii, period, per our rules. If they're an asymptomatic individual or someone that's not had a test and we give them a test, we will catch a large number of their positive cases, and their rate is like 1 out of 300, which means with a test, the tests are 99% sensitive, but even if you had a crummy test, it's 92% sensitive. You will shrink that number very significantly down to well under 1 in 1,000 people that are traveling. So if we have 8,000 travelers, we will have 6 to 8 people coming in that could have COVID. If we can't handle 6 to 8 people a day, we can forget ever opening Hawaii again until there's a vaccination. If people want that policy, that's okay, but then we just have to accept 17 to 21% unemployment, no resources for the public schools, no resources for the public hospitals, no resources for the vaccination program. it is a really big mistake for people to use fear, like Mr. Waters. His idea was really not very smart, and to throw those numbers out. Throwing numbers out the wall that it's going to be 5 or 10% people coming in positive, that we won't catch the disease, that's not science. That's fear, and that is xenophobia. And unfortunately, that may be what happens. If a second test is required, I want more testing, but if you ask for a second test without a quarantine, I mean, making sure that people have to have a quarantine for 4 days, so they have a first test, quarantine for 3 to 4 more days, get a second test, and they have to be in quarantine, they will not come here, which is, again, if that's the policy decision and we're willing to accept 17 to 21% unemployment, that's a decision. That's okay. People can make that decision. I will live with it. But I can tell you lots and lots of people out there, mostly people who are socioeconomically well below the median, people who are in the service industry who are having a very tough time, they're getting creamed. They're going bankrupt. They're going to be homeless. They can't afford food. They have food instability. It's really, really rotten for people to go with the idea that you have to have like 3, 4 tests, which some people, they're recommending now 3 extra tests on Big Island. They have no cases practically. None. So yes, we have to accept some risk if we want to open up, because you can, otherwise you use the exact same fear tactic. How can we let our schools opening up are far more risky than having tourism coming in, just so you know, based on the numbers, because people aren't getting any tests right now, any tests at all. So it's really a perverse discussion that's going on, unfortunately, because people are so freaked out about COVID. And I'm trying to apply some common sense and actual numbers. Now, at the end of the day, if a decision is made to stay locked down until December or January, what it will mean will be I will fight hard to make sure vaccination is good, and then people will feel more comfortable and will change the tone of the discussion will change, and we will then open up. It will mean that we'll have extra few years to deal with the poverty that is generated. I would say many thousands of young people will probably leave Hawaii and go live on the mainland where they can work. And it's not too bad to catch COVID if you're young, usually. And that's what will happen. So I will keep trying to be as analytical as possible, and believe me, as safe as possible. Just so you know, guys, I'm the only one who fought in government for an actual test at all. Everybody else was just going to open it up. That was the pressure. There was going to be no pretest, but a pretest will give us some significant assurance that no one is coming in here positive at all, or very small numbers. And I hope that these are the kind of things that people actually think about. I would frankly much rather see us keep our numbers low, but do it sensibly and then adjust. And I've proposed that we do strategic surveillance 4 days after people come here and test those that came, and we'll do it either at random or optional testing, and we'll have the scientists do a good, they'll do the statistics properly to make sure that we're not seeing a surge. The one point I will concede is that, yes, when we go back to work, I guess I have to close here on this point, or school, if we don't wear masks pretty well, we will see a big uptick in cases, and then we will have to go backwards. But it's the mask. It's not the airplanes. It's not the guys from New York or some strange traveler or from China or Japan now. People are going to get tested. It is our own adherence to primary prevention, mask, contact tracing and testing, and being kind to people. And so that's what we have to do. Otherwise, it's our own responsibility to keep COVID from spreading.
Thank you so much, Josh. We really appreciate your availability, your willingness to come and tackle these hard questions. And we appreciate you as a parent with skin in the game in public schools as well. We know these are all issues that hit close to home for you in multiple ways. So thank you. We know you need to sign off, so we'll let you do that. And we're going to go on to our other panelists. So have a great rest of the day and weekend. Thank you.
Thank you for including me. Take care. Bye-bye.
Okay, and now we get on to our next panelist, Margary Martin. And Margary, if you could address some of the questions, given the emotional roller coaster mentioned by many of the respondents in the survey, how might families address their children's socio-emotional needs as they are remaining home and sheltering in place? And what suggestions do you have for families to cope at this time and to motivate their kids. Thank you.
Great, thank you so much for having me. I'm going to share my screen. I put together a small PowerPoint, and I'll try and keep good track of my time here. Okay, so I'm going to focus today then on those questions, but I'm going to kind of wind them together a little bit. And before we begin, in thinking about sort of our functions of schools in general, they mainly serve three needs, right? We have academic needs, that's very clear for all of us. There's a monitoring role that it plays, whether we're talking about 5-year-olds or 17-year-olds, you know when your children are at school, where they are, yeah? And then social and emotional needs. There's been a lot of attention and increasing attention around social emotional needs, but it's really become exacerbated now as COVID goes on and on. So I'll be focusing on that. So I want to start off with just having us think a little bit about what are the social and emotional needs of our children. There are many, but I'm going to focus on the ones that I think we really need to address now, and that also came up in the concerns in the survey. So first and foremost, there's safety. There's a physical safety that Dr. Green was talking about, that we literally know where they are, that we know that they're safe, that we're mask wearing, that we're all those kinds of things. But there's also that social emotional safety piece. It is scary times. It's scary times from COVID. It's scary times in many other ways right now. So that sense of safety is really key. A sense of control. This is directly related to safety. We need to have a sense that we are in control of our lives. And right now we aren't really in control of lives. We have to stay home. We can't go to school. So thinking about that sense of control. Connection. This is another kind of a need that is greatly impacted by COVID. Our need for both connection and belonging, right? Especially as children get older, belonging with their peers, belonging in a school. For older kids, thinking about graduation, like what does this mean to belong and how do I connect with others? And then voice. COVID and these times are being done to us. So this also relates back to that sense of control and that importance for us to have that sense that we have a say in what happens to us and what happens in our days. And this is important for all of us, and also for our children. So looking at it, I decided to divide it up a little in two different parts, because when we think developmentally, the needs for children that are 7 are a little bit different than the needs for kids who are 16, right? So thinking about childhood, those elementary age group. This is a time when children are really developing their self-concept, and our sense of ourselves is validated from adults that we interact with. And importantly, at this age, it's often adults who are not in our household. So for example, I have a friend who will always send her child's drawings to my husband, who is an artist, and she's 9 years old, and he will look at that. He'll provide feedback on that, validation for her, and she says like, well, he knows what he's doing. You know, Uncle Chris knows this, right? So that kind of validation. They need routines and predictability in their daily life. They might fight with you a bit on these routines on a daily, but having that predictability around the structure of their life is very important. They need these opportunities to practice pro-social behavior. And Principal Kuba will be talking more about the kind of social emotional learning and these pro-social behaviors, but opportunities to practice things like empathy, social awareness, and being able to identify and articulate their feelings. And finally, they need to play. They need some non-structured play. This is where imagination happens. This is where future thinking happens. These are our imaginary friends that we're being social with and practicing all of these different behaviors. In terms of adolescence, thinking about that importance of access to a peer group and access to social connections. And clearly COVID has hit this very, very hard, and they're very aware, I'm sure, of this. They need opportunities to feel competent. I've encountered a number of adolescents who are very, very ashamed about not performing well in school, and then they don't want to go to the class, even online, and it becomes this sort of spiral. So thinking about ways that they can feel competent. Students at this age need to feel useful and feel needed. So the more that we can get them thinking about others, the better it is for their social and emotional well-being. And finally, COVID has shattered for many adolescents what will happen in their future. Sometimes we forget that time goes really, really slowly for children and youth, and it's also a super dramatic time in life. So everything can be sort of the end of the world sometimes, right? They don't always see through to the other side. So while we can see that COVID will end and they can go on to college or they can go on to the things they want to do, for adolescents, they might not always see this. And we need to help them through that. So with that in mind, there are some children and youth who might be at risk for mental health needs, especially if you have, let's say, a really social child who suddenly isn't social anymore. So when I go through this list, think about those drastic changes that might have happened. And this is going to be a smaller percent of our children. While we all have a bit of pandemic trauma, every single one of us, there's some that it's more exacerbated for. So some of the signs for these things. One is a sense of disinterest and disconnection. So not showing up even when they're present. At the dinner table, they're not present. They're just completely disconnecting. And isolating themselves socially. So socially, of course, we can't physically always be together, but there's FaceTime, there's other ways that they're communicating with each other, but they're not now. So that kind of self-isolation around that. Being really easily panicked, even more so than usual for some of our children. If everything just throws them off, that's a sign that they could be having that sense of trauma. It could be something that you could easily work with them in terms of calming times, and I'll give tips in a few minutes, but if it's more extreme, that's something we need to keep an eye on. A lack of hygiene or sudden changes in their looks or affect. So you see suddenly, and I think all of us, I have to admit, I'm not as hygienic as I used to be, but I make myself brush my teeth, but extreme kind of changes. Another interesting one that was noted in the Journal of Pediatric Medicine was thinking about hoarding. That if you find that your children are suddenly hoarding, we all did this at the beginning, right? We all went out and bought like enough toilet paper for the next 5 years. But that kind of hoarding can be a sense of that lack of control. So that's something to look out for too. And then I mentioned like this inability to envision a future for themselves in any way. There are resources at schools. They've been doing phenomenal jobs between the counselors and social workers at many of the complexes that can provide you with resources, and if you need it, to connect your children to services. So a few tips, and I was asked to think about those 3 things that were mentioned earlier. And when we think about these different needs, I'm kind of combining them into tips that speak to all of this. So we think about motivation to do work. If we are addressing their needs, they're more likely to do the mundane work that they might not find so interesting because they have other things. So first of all, co-creating structures and routines. Having children take a leading role when they're creating a weekly plan, and have them share their daily plans with you. This can include other things besides just school. Think about things that they can contribute to the home so that they feel useful. Time for fun, schedule that in. If you know you have playtime coming up, then you can sit through maybe something that might be not as interesting for them. Time for reaching out to friends, families, others outside in the old-fashioned kind of ways, like letter writing. Letter writing to an auntie, right? Drawing and texting pictures, like I mentioned, phone calls, even FaceTime. We're worried about screen time, but for me, there's a difference between passive screen time and then things that they're constructing for themselves, to be able to do a check-in with their best friends, or to play a game, or to do a shared movie, right? None of us want them in front of the screens as much as we can, but having that time that has some control for them is important. Other things that they enjoy that you know of, you can put that into their schedule. In addition, thinking about school as something that you start and end. So we set up their stuff in the morning, but having like a box, I know I'm doing this myself. At the end of the day, I put all my stuff in a box and I put it away so I don't see it, right? And having that routine of school is now, school is over can be helpful for them. Schedule a cutoff time for schoolwork. Many people have mentioned, I've heard from others too, about staying up to 11, 12, 11 at night, 12 a.m. That's not good for any of you. If this is happening, reach out to your school. We want them to do the best they can, but we have our limits. Time to talk. Scheduling time for even short little check-ins that are initiated from your children. So not saying how was school today, but like, oh, what happened today? Tell me about something that happened today. Or you can share yourselves. And then if they bring up the academics, you can do that. But sometimes that can just be like a pressure bomb immediately, especially if they're feeling shame. Time for quiet. This is my mother's favorite one. This is a tip I'm actually taking from my mother. Schedule 30 minutes a few days a week where the household reads or writes whatever they want. Reading and writing whatever you want will support their literacy in general. And the part my mother liked, it's also known as parent break time. So time for you to be able to have some of that space. If you model that with them by reading and writing, at least for a while till the routine is going, then this is something that can be really powerful to support their literacy and support everybody's social emotional needs. Providing opportunities to feel useful. Giving them an early morning chore, especially adolescents, so they can feel competent, and for adolescents, get up in the morning. Many of you already, I'm sure, do some of these things, but just throwing some of these out for you. Have them choose a volunteer opportunity. This is really good for middle school and high school, also late elementary. Citizen science has a lot of great ideas, writing letters to Kapuna in nursing homes, mask making, there are a number of these different things. Consider getting a pet, even if it's a goldfish, so that they can have something to care for. Opportunities for social interaction and civic engagement. I've been working with a lot of out of school programs who are not having as high participation as they usually do, and they have great things going on. So reach out to your school, reach out to the YMCA. They're doing a lot of very, very cool things. Student created clubs with their friends. Get a shared interest, create a club. And then finally, I spoke to about exploring their future selves. Have them explore career considerations, talk about what's going to happen after COVID, keep them excited about those things. If you have access to the outdoors, I think we know about these, but think about non-structured time out there as well. And then most importantly, remember that social and emotional well-being is the foundation of academic success. If you have to prioritize between getting the test done and taking care of your child's well-being and your family's well-being, that needs to trump it at this time. It's okay if everyone does their best and if the schoolwork isn't always done. Assist with school requirements as you can, but reach out to teachers when you have difficulties. And remember that you do not need to be their teacher. They always see you as their parents. Unlike us, they can't really see that toggling in our different roles. Mom is mom, mom is mom, mom is mom. Whereas maybe us with another adults be like, okay, I'm being the doctor now, I'm being the professor now, I'm being my mama now. And then most importantly, release yourselves from feeling shame and tell your children to do the same. Mahalo.
Wow. Thank you, Marty. Those are fabulous tips. I had to laugh when you mentioned quiet time because I know that's how my mom coped with 4 young children, and I hated quiet time, but now I think it's a really good thing now that I have kids of my own. So, and again, fabulous tips, and all of those slides are going to be available on the website. So anyone signing in who's logged on now can access those to go back and reference. So again, thank you so much. Now we're going to hear from Principal Kuba from Jarrett Middle, and if you could address what schools are doing to keep children as well as teachers and staff safe as school resumed. If you could address inconsistent teaching and learning taking place during this time, and what is your school doing specifically to address this? And socioeconomic or socio-emotional learning issues as well in your experience as an educator and as a parent. So thank you.
Yes, thank you. Thank you. I just want to thank everyone for the opportunity to come and share. Let me get my screen up to share. And I will expand on Dr. Martin and what she was saying and talking about social and emotional learning, but kind of focusing more on the academic or the learning aspect of things. So I do want to share that the new buzzword around education now has to do with social and emotional learning. And for those of you who've been around education long enough, or even if you think about our own, these are the 5 main areas that are part of this social emotional learning. However, if you look at it and you kind of look at the definition, you realize that we've been doing this since we were kids. How do you control yourself? How do you work in teams? And I think now what we're looking at is how do these skills help students in their learning? So as I looked at these 5 areas, social awareness, responsible decision making, self-awareness, I kind of saw that unfortunately during these times during distance learning, the last 2 are most significant during this distance learning time. Responsible decision making. If you look at how your child is choosing to, when they choose to study or when they choose not to, those are all decisions that affect their learning. Whether they actually choose to, unfortunately, some of our students are choosing which classes to go to and which classes not to go to. Or maybe it might be their math class that they somehow are finding tech issues, but no tech issues in other classrooms. So these responsible decision-making strategies really do affect their learning. And then as parents, if you are a parent of a young student, you may need to help them with this number 5, which is self-awareness, knowing their strengths and their weaknesses. And I think what the most helpful advice I would give is when we know our child's weaknesses, we don't cover up for those weaknesses, but we help our children to learn how to work through their problems. It's okay to struggle, but to help them through that and to guide them and to facilitate rather than to put a Band-Aid over it, where it may show up later in the older years as a bigger problem. So again, as I review, social emotional learning is a big topic within education nowadays. But again, it's things that we were doing or the teachers were trying to implement within us as we went through schooling.
Hey, Reid, I'm sorry to interrupt, but could you
Sure.
just, could you advance your slides so that we can see? I know, I think you just went through slide number 2, but we're still on slide number 1.
Okay. I'm going to stop sharing. You see the 5.
There we go. Thank you so much.
Okay. Yeah, I'm sorry, parents. So that, again, these are the 5. Number 4 and 5 are the ones that I underlined because they are more pertinent to distance learning. Yeah. But still at the same time, there are ways within this model of learning that do come up. It's just a little harder because some teachers are good and they have have students working in teams. But of course, going face to face, you'll see these first 3 being more prevalent. Okay. Let's see. Okay. So related to that, I just wanted to share just a self-reflection on my part. There are two very important lessons during this shutdown that I've learned. And I realized that parents may not necessarily realize this, so I want to share this as an educator. One is that these social emotional problems that may come up are more prevalent during transition grades. What I mean by transition grades would be kindergarten, because that's the first time they're coming to school. They're going from preschool to kindergarten. Or it might be sixth grade, because they're transitioning from fifth grade to sixth grade, and of course, ninth grade. And for those of us who have college students, even going from high school to college. These transition grades are, in a normal situation, challenging in itself. I mean, you have in ninth grade, you have the highest, across the nation, the highest dropout rates occur within the ninth grade. So these transition grades are really important to note. So if you do have children in either kindergarten, sixth grade, or ninth grade, kind of take a closer look at how they're managing this distance learning. And the reason why it's even more important to watch during these transition grades, because they don't actually know their teachers. They haven't seen them in person. They only see teachers as a person on the screen, a torso, or a face on the screen. More so, they don't know their peers, especially going from elementary to middle school, where there's kids from all different schools. They don't know their classmates. So this is a huge shift from when we did distance learning in fourth quarter. Fourth quarter, they knew their teachers, they knew their classmates. Teachers, which is really important, teachers knew them. So the teachers could actually look at a student and know something was wrong. Hey, maybe I better touch bases with this student. But these transition grades are important because the teachers don't know the students. And again, it goes both ways, where the teacher actually, we only see a student and their face on a screen. It's hard to catch a student and find out whether they're something's happening at home. Maybe they're not having a good day. So these things, these responsibilities, have been transferred back to the parent. So that's one important thing that I really learned during this time, is to try and really watch those transition grades, because we don't know our children, we don't know our students well as educators, and the students don't know us as well through this distance learning mode. And the second, we worry so much about, as great parents, as concerned parents, we worry so much about our our children. But through this, because I speak to a lot of parents as an administrator, I think, and I believe that parents' well-being is just as important, or in fact, even more important than your child's social emotional well-being. And what I mean by this is not that your children aren't important, but we as parents are the foundation. We as parents are their support. And if we cannot support them and we cannot be that foundation, their social emotional growth, their social emotional well-being gets worse. So that's what I mean by parents being more, more pertinent during this time. And I do want to share one resource that came out of the University of Hawaii. This is the best one that I've seen during this time. Let's see if I can find it. Sorry. Do you still see my screen? Uh-oh.
Hi, Reid. We lost the screen
Okay.
share.
Okay, you should see a Ohana caregiver information.
Yes, we have it. It's
Okay,
there.
great.
Thank you.
So this is a one resource that I found the best for me to share with my parents. This came out of the University of Hawaii, and it talks about not only the student, but more so the caregivers. And as parents, we are caregivers to our children, and some of us are being even caregivers for our parents if they're elderly. But I think the most important thing as parents is to understand, and you probably all do, that you are a role model during these difficult times. We are giving them the strategies to deal with challenges that they face on a daily basis. So through this piece, it talks about if you come home and you did have a challenging day, what are your next steps? Because your kids are watching you. Yeah? Do you take out a drink and excessively maybe drink, or raise your voice, be short, increasing the stress level within the home? Your kids are watching. Yeah. So they give different ways to look at how you are as a role model, and different ways to deal with those situations. And you're actually, by your role modeling, you actually are helping their social emotional growth. And the second page of this handout, which is what I really wanted to share, is, and what I really like, is it actually gives you things to look for. And I know that was shared previously, but here's are some physical things to look for, and it's broken up by age level, and then how you can respond and give strategies. So that's why I really like this. Of course, the one flaw in this, if you notice, I always ask, hey, where's the middle school? They left us out again, like the middle child. But you got elementary school and high school, things to look for, and how to help. So that's why, I like this handout. And I can figure, we'll have that handout available, and I'll share that with our Parents for Public Schools, and maybe we can put it on the website. Okay. Let me get back to do you see number 2, children's learning, Claire? Okay, thank you. Moving on to children's learning, I just want to share some few things that we've been learning in the school level, which will help your child to be successful during this distance learning. At our school, we treat distance learning like school. So trying to, like, we have uniforms at our school, so we also ask that kids wear their uniform for our distance learning. We have a daily schedule. Our schedule is similar to what we do in school. So there's 6 periods a day, 6 classes a day on the hour. So they need to wear their uniform. We also ask them to make it like school, where fix your hair, make sure you brush your teeth, get ready for the day. If you don't have to wear a school uniform, or your school doesn't have uniforms, maybe make sure your child wears appropriate clothing. In 4th quarter, we had a lot of kids within their bedrooms and sitting on their beds. For our school, we changed that. We asked the parents to try and find a nice place for them to sit out of their bedrooms, or at least find a chair for them to sit on. And that's just trying to create an environment for learning to be successful. And that's a part of this. The second one, creating a learning space. Help your children to be organized within that space. We all know that students who are organized are more successful. If you do have multiple children in the house, headsets are extremely helpful. We see our students with multiple kids in the home, they have a hard time focusing on class. So being able to get a headphone with a mic is really helpful with multiple children in the house. This is really important for parents. Know the resources at your school. What are your teachers' office hours? Does your school have online tutoring? We have online tutoring. We have in-person tutoring. So find out what the resource is. We have also face-to-face options in our school. So find out those resources at the school. And one resource which is really important for if you're a parent of a middle schooler or high schooler is Infinite Campus. Infinite Campus is a platform that the DOE uses for attendance and grades. So middle school and high school, you're able to have a parent account, and you can check what classes your students went to, what classes your child went to, whether they're tardy, whether they're absent, did they show up for class, as well as their grades. So in our school, we update our grades 3 times a month, not 3 times, 3 times a quarter. So, and we let our parents know to make sure they check their Infinite Campus. And on there, you can see what assignments were assigned, what tests were given, what the grades your child has. So that's an important resource. And the schools should have given you your passwords and instructions to log onto Infinite Campus. So if you're not aware of that, you can check with your schools. Those of you who did sign up for Infinite Campus, you know the process because it is daunting. There's something like a 30 or 32 digit password that you need. So, and if you mess up on one of the digits, you got to start again. So it is difficult, but parents do get individual accounts. Some schools have Google Classroom and they keep their grades and assignments on there. So I know with Google Classroom, it actually lists the things that students still need to accomplish and which things are done. So that's really helpful for parents. If you are an Acellus parents can get an account to actually live monitor their student and see if they're actually on during the day at the times that they're supposed to. You can also check their grades and their progress with a parent Acellus account. And the last thing for wanting to share to help your children's learning is continue to be your child's advocate, but I put in their quotes, a silent advocate, because when you start, I know for elementary that would be different, but in the middle school and high school, if you start asking teachers questions and administrators, which is fine, I would say that training your child and teaching them how to do that actually helps them with their social and emotional learning on being responsible, solving those problems, and building that adult-student relationship. Yeah. There's ways to teach them how to email correctly. It's not a text message to their teacher, but actually writing a letter, asking for help. Those are all skills that help them with their social and emotional learning. And so use that opportunity to advocate for them and support them with that. The
Great.
last thing
Reid, if we can just wrap things up in the next minute or two. Thanks.
Sure.
Thank you.
This is my last slide. I did ask my teachers, I told them that I'd be sharing with parents. And so what things would you like to share with parents? So this is some advice from my teachers. When classes are in session, like I said, treat it as learning time. So, turn off the television, music, video games, and cell phones, and focus on the learning. The other is academic struggle is good. Let them struggle to the problems that they're having. Teach them how to solve those problems, give them strategies, and let them fail and pick them up again. I mean, that's how we learn best, and that's how we all learn. Get active during the breaks. Schedule that during their daily routine to energize their brains. And of course, this came from my PE teacher. The big one is watching their attitude toward distance learning. It does rub off on your child. For me personally, I believe face-to-face is the best way to learn, getting kids on campus. And that's how we were planning to do all of this before things changed. But this is the second best. So watch how the discussions go within the home, because it does affect how they learn. And when we show those negative, if you have any negative inclinations towards the distance learning, that may rub off on your child and actually have them not want to participate or not be motivated to do well in their school. The last two are funny ones from my teachers. They asked, please don't do your homework for your kids. We are able to see, many times we catch that, with new vocabulary that we've never seen before, and suddenly they write perfectly. But we do want to share that if we don't see problems that the kids are doing within their homework, we can't help them. So, and I like the last advice from one of my teachers. Please don't answer the questions for your child because we can hear you. So, and it's worse when you get it wrong. So let them struggle, let them go through it. And again, thank you for letting me share today.
Great. Thank you so much, Reid. There were some questions that came in while you were speaking, and we'll address those at the end. We're going to move on to our final panelist, Deborah Bond-Upson. And Deborah, if you could address what the challenges, what you see as the challenges and opportunities linking digital learning to the current situation we are facing. Thank you.
Thank you. Just one second. I'm having a little bit of a technical issue. There we go. Dr. Martin and Dr. Kuba's advice for parents and families is just tremendous. I'm really thrilled to hear it all, and we'll keep consulting it. One of the points that Principal Kuba just made about let's not discourage the kids about distance learning is really something that I can segue into easily. As we look at this pandemic and the hardships and the difficulty and the frustration we've all faced, it's great to look back at our history, our Hawaiian history, and look at the fact that between 1820 and 1834, King Kamehameha II and III led an amazing onslaught into what was then the digital media of the time, which was the printing press. And by instructing the missionaries to create a written alphabet, and then by publishing primers and Bibles and other resources, suddenly Hawaii became one of the most literate nations in the world. And unfortunately, after the overthrow, when Hawaiian language was not allowed in the schools and schools began to close and the bifurcation of private and public schools began, our schools started to struggle more. But looking back at that inflection point in history, many organizations in Hawaii and individuals right now are looking at what is this pandemic forcing us to do? How can we grow? What can we gain? At the same time, we've lost lives, we've lost businesses, we have families that are undergoing great stress. At the same time, we are learning more about these tools that can transform our lives. And we're facing the fact that we have not had digital equity. That at the same time that we have now a digital world, that really any child or adult needs to be able to interact with in order to move forward, get a career and learn. Now we can see how stark the inequity is and how critical it is that we get internet access, high speed to every child and adult in Hawaii, and how important it is that we get digital devices to everyone. We found in our surveys of parents in public schools that even the families that felt that they had devices didn't have devices necessarily that supported the education that kids needed to have. And sometimes you had 3 or 4 children sharing one Kindle, and so that device was not enough. At the same time, we're facing this big crossroads where we have difficulty, and many people are frustrated by how hard it is to do this digital learning, by the social, emotional crisis that we have for kids and for families. We have strengths in Hawaii. You know, we have a history of a strong ohana, and we have a history of courage and embarking in new things. And we also have a need. We've seen this pandemic has shown us what happens if the tourism industry shuts down. We don't have enough other new industry. So we can use this emergency as a way to help us get into a new path that can build a better future for us. In order to talk about that, I want to talk for a moment about what are the technologies and protocols that we're hearing about. We've heard a lot of parents who are confused about what does distance or virtual mean, what does hybrid mean, what does digital mean? And I think it's important for us all to know that digital is the core concept that has to do with organizing information and communicating it through electronic means that enables us actually to reach all people if we have the wiring set up. And also it enables us to personalize. And digital content or communications may be used at a distance, but they also may be used on site. And more our teachers in the classroom are using digital resources to help to educate our kids. And kids are building digital resources to be part of this digital economy. Distance and virtual learning occur with learners at a distance. Synchronous and asynchronous learning, it's important for people to understand that you can have teacher-led instruction even if it's asynchronous. A teacher can record a lesson that's important for their particular age group and subject, and it can be accessed at another time. But another way to go is to have canned or universal learning that may be used either synchronously or asynchronously. Face-to-face and site-based, we all understand learners are sharing a physical space. Blended and hybrid mean that we're combining part face-to-face, part at a distance. Adaptive learning is an important concept because we can organize knowledge electronically, we can organize the media that teachers have developed. We can now advance items based on an individual's knowledge so that we're not boring the kids that are ahead or challenging kids in a way that's frustrating. Project-based learning is an important concept because it's a way that we can engage learners individually or in small groups in work that feels authentic rather than work that feels like it's been made up as an assignment for school. And authentic assessment is an important concept. Now these electronic digital devices that we have enable us to actually evaluate student work, not just grade tests. Wanted to note that before the pandemic, we already had digital challenges. We're feeling digital challenges now, but they were already there. New industries needed people with more digital skills, and we weren't able to attract enough businesses to Hawaii out of a lack of trained employees. We had an inequity of internet and devices. Screen time and social media were affecting keiki and families and creating social emotional problems along with other causes. And in fact, social emotional learning became the national #1 budgeted curriculum in 2019, a big surprise to everyone who's always thought it would be STEM or reading. But it's been found that an investment in social emotional learning actually helps to rise performance in all the academics. We've had schools that have lagged in digital learning and in family communications. We noticed Principal Kuba was looking at the importance of knowing about Infinite Campus. In our surveys, we found very few parents knew how to use Infinite Campus, for example. And so a systematic training of families and a look at how to simplify and how to strengthen our digital communications with families as well as students and teachers is critical and has been lagging. Multiple jobs, other primary languages, and a lack of digital or curricular knowledge have stressed families who are trying to support keiki. So all those things already existed, and now we have the pandemic. So we have additional childcare challenges. How do we ensure health for our students when we don't have school for them to be monitored? How can we support social emotional wellness? Teacher-student contact is critical. How can we optimize the interaction with teachers when they're not in school? Parental learning guidance. Parents become even more important as mentors and as examples. How can they guide when they feel they lack the digital curricular skills or access? Learning effectiveness. How can all students, including and especially special needs and elementary students, be motivated and served when it's virtual? And digital equity. How can students have equal opportunity if some do not have these devices, connection, or parental support? I wanted to notice that in this time where the pandemic has pushed us, it has pushed progress in paradise here. And I just am looking at a handful of opportunities that have happened and community groups that have picked up the baton to move it forward. Digital inequity, the broadband Hui and Transform Hawaii are developing the Declaration of Digital Rights and ideas of digital equity and digital literacy that will help, we believe, propel all of our citizens as well as our schools and develop new industry in Hawaii. The Department of Education digital systems were really lagging from the point of view of many of us. And in this emergency, they've instituted widespread Gmail accounts and Google Classroom. And there's an online evaluation of more advanced systems that we've needed and we need now. Childhood trauma is increasing because of this social emotional learning needs and because students are at home with families when families are stressed. We have a $5 million grant to the DOE, and the Department of Human Services and community groups, including Parents for Public Schools, are working together to look at ways to get trauma recovery services to students and families. The Hawaii Department of Education planning and implementation has been questioned by groups, and this is part of what's caused us at Parents for Public Schools to survey and to represent what we hear from the parents. The HEE group, Hui for Education Excellence, meets weekly and has been giving testimony to the Board of Education, bringing people's concerns about planning and implementation. Childcare and programming are big emergencies, and we've seen the Hawaii After School Alliance provide website resources, research, and webinars, and Hawaii Children's Action Network has been advocating and resourcing, and all of these efforts are leveraging digital resources to bring improvement. I wanted to notice so many of our parents and all of us are worried about learning loss during this time. Ed Week on a national level has looked at what are the 4 key issues that generate learning loss that can cause that risk. And one is the hours of family learning support. Another is the hours of teacher contact. A third is internet at home. And the fourth is device availability. And if you look at the map on the right, our Hawaii map is red, and that means we are at much higher risk. The surveys that we've done, Parents for Public Schools in the 2 colors of blue, and the Department of Education in the purple, and the EdWeek National Metrics in green, we've all found these factors to be important issues that are problems for learning and for our families. Our local surveys also found inconsistent learning modes across complex areas and schools and grades, and inconsistent planning and communications as problems that we see maybe playing into learning loss. I wanted to notice, though, that the Hawaii DOE, meanwhile, has been surveying more, finding new ways to do it. And their contract with Panorama Education has brought about a number of surveys with teachers, with parents, and with students. And those survey results are all up online and very rich, and you can explore them either by complex area or by state. And we have links to that dashboard on our website. If you look at that link or just go to our website, you'll find the article and the link. And also, Panorama provides access to a range of free resources, including adult SEL, which helps with what Principal Kuba was talking about, the importance that we model for our students. So all these resources are there, helpful for parents and teachers, available for free and accessible through that link. Now, the heart of what I want to talk about is we know digital learning is not as good as face-to-face much of the time. I would argue that sometimes it can be even better, but usually when it's blended with face-to-face. And digital learning works when, in my view, and from 30 to 40 years of experience in working with this, with schools and teachers and students, it works best when the leader leads the learning experience. That's the opposite of a canned education program that's not led by a specific teacher. Not to say that none of those can be useful or effective, but it is the opposite of the teacher-led learning experience. And when teacher time is respected, when we can have the highest use of teacher time, and a program that I worked with was developing high school courses for career technical students in Ohio. And we had teachers build lessons that students could access at any time. And we implemented assessment throughout it so students could see how they were doing. And because the teachers' lessons were recorded, all of their time could be spent looking at how the students were doing and conferring with them through the platform, texting and phone, about what the student knew and what they needed to do next. And I found that students would say to me, I've never learned this much. I never had a teacher who knew how I think before. And so this item, how does the the student feels seen and understood and valued by the teacher. And if the student can feel that the teacher knows how they think and what they need to know, then we have an investment in that student that they feel and propels them forward. Galaxy Classroom is another program I was involved in where we use story, and teachers of elementary school science students would show a video of characters, puppets, and students who would interact about science experiments, and then the students in the classroom would do hands-on experiments and then would confer with the characters by sending emails and texts to them about how to solve problems. The students felt seen by these characters. They get answers the next day, and this conversation propelled their learning forward. It was a mix of story, media, hands-on education, and communications. Digital learning works when teachers have professional development and planning time. Sometimes we waste teacher time by making them do the same thing over and over, by making them enter student records online when it could be done another way more efficiently. One program I worked with was to develop an adaptive assessment of teacher technology skills for the state of Georgia. And about 60,000 Georgia teachers took this assessment in order to place out of required attendance at technology classes so that they could take classes that would really benefit their instruction. So if we honor the teacher time and try to do whatever we can to make sure that they get the most of what they need and their time is not wasted, that's a big investment in our schools. Asynchronous local-made media lessons developed by our teachers that students can stop and start and watch again can personalize learning. I've worked with programs to develop with districts their own teachers' lessons, integrating media and research, and then having them available for other teachers across the district to use. We wouldn't need to buy canned learning from other sources that are not sensitive to our local needs if we took our great teachers' lessons and make them available according to learning objectives and assessments and the other aspects that teachers and students need. These recorded lessons can serve multiple class sections, freeing teacher time for more one-on-one and small group work. Digital learning also works when there's been strategic planning, learning systems and curriculum are optimized. We have work happening at the district level, and groups like Hey and others are working with the district trying to see that we do a scientific strategic job of moving this forward. Digital learning works when the district complex areas and schools communicate clearly to families. We've heard from many families that they didn't know where to look. They got different information from one group than another, that they didn't know when they would know a certain thing would happen. We know we need to get better in this area. Students can use computer-based practice activities, and that can help them, even if it's not teacher-led, if it's teacher-guided, because it can show them immediate progress, encourage them, and the results can inform their teachers to make that relationship between teacher and student yet closer. And when students research, learn to research appropriately, learn to spot false information, discriminate, they can present those research projects to groups. Also, when students use constructive apps to write, design, think, and make, like Makerspace for the Humanities, Storymaker, all kinds of apps that are available now to teachers and students and families, the student can work offline and can create knowledge themselves. When we provide additional resources, those students who have an interest in one area or another could get ignited by a supplemental resource that we make available to them. So clear archives of information that a teacher or a school or the district can provide for families and students will help. Project-based learning is another way that digital learning can work. On-screen and off-screen work can be guided by the principles of project-based learning. PBLworks.org is a wonderful website that gives guidance on how to lead these projects. And EL Expeditionary Learning has a collection of resources and projects that you can do at home that will move learning forward. Another important piece is to find mentors for students. If your student has an interest in science or health, to find a mentor. And one way to find mentors is to go to mentoring.org. And lastly, community projects enable students to relate to organizations and people in their area online until it's safe to do it face-to-face. So those are just a few of the ways that I can see that digital learning can help us to move forward. Thank you.
Fabulous. Thank you so much, Deborah, and to our other panelists. We have a number of questions and we want to get to as many of them as we can. Since we didn't have to actually drive to the annual meeting this year, we thought we could hopefully extend time 15 minutes for those of you who can stay on. We will adjust our agenda a little bit to do Q&A until about 11, and then we'll talk a little bit for those who can stay on about the work of Parents for Public Schools Hawaii, a little bit of our history, and what we're currently doing in the future. If folks do have to log off, a lot of this information is on our our great website that's at ppshi.org. So if you can't stay with us for the additional 15 minutes, please take a look at the website. So let's dive into some questions for our panelists. One question, and this might be for you, Principal Kuba, about indoor air quality inspections. Once students go back to school, either full-time or in a hybrid model, have you received any guidance from the state as far as the quality of air and what to do? I know Dr. Green talked a little bit about, trying to keep windows open, but what do you do if it's 95 degrees in the classroom and you can't?
Well, we've received guidance from Department of Health, state, and actual testing of the air quality that I haven't heard anything about whether there's some device to do that. But the advice that we've received obviously are opening the windows, keeping the doors open as far as ventilation. If you do have fans, the fans should be facing, say, by the door and pushing the air out. Or if it's facing, so it shouldn't be on a student and then blowing it to everybody else. It's actually pushing the air out of the classroom so the air keeps flowing through. And then as far as air-conditioned rooms, even those, they've asked to open windows, open doors, or look at HEPA filtration systems. So those strategies were given to us, but as far as testing of the air quality, that's not something that we do.
Okay, thank you. For Professor Martin, what do you suggest for students brand new to the community or students who've just moved here to help them make new friends safely?
That's a really big problem. I've been thinking about that even with some of my own students at Hilo who are brand new. One of the things I can speak to what I've done as a teacher in a piece is to set up small groups that are accountable to each other. Think about who the new, like if you get a sense of what the new students are interested in, and then you know the other students, trying to kind of match them, but not in a way that says, Joe, you should hang out, with Lily. But, by being strategic in your pedagogy and how you put these groups sort of together and having community building activities that can allow them to meet with each other. Also encouraging them to join some of these great out-of-school programs. They're doing so much great work right now, in particular the YMCA, YWCA. There's many others as well, because those tend to draw people from different schools. So being the new kid isn't always so obvious. And I know it's tough because so many of us, we're in communities that are pretty small and we all know each other, right? So those would be a couple of my suggestions.
Claire, you're muted.
Hi. Yeah, sorry about that. I was trying to unmute a little technical difficulty on my side. Hi. Okay, thank you so much for that. Question for Reid. Is there anything illegal about teachers organizing safe face-to-face meetups off campus at this time? If it's not a school-related activity, could a Hawaii Department of Education employee be reprimanded for doing this?
Um, I think, well,
Yeah.
as long as the activity is not illegal. Of course, if it were, then it would be. One thing I do know, if it is for tutoring or academic reasons, I do know that teachers should not be tutoring their own students and getting paid for it. That's just unethical. So, but if you know, I know some teachers tutor maybe their student that they had 2 years ago, and you know that kind of thing is fine. Um, it is on the teacher's own time, but during this time I'll be extra cautious. And depending on the situation, what comes to mind is um, whether we're in this pandemic or not, I would not recommend if one of my male teachers asked me if they could meet with a female student at McDonald's, I would say no, even though that's their own personal time, but it's just, you know, a good thing to recommend. I think discussing that with your administrator would be best, and then you can work out the little, you know, details as far as liability and whatnot.
Okay, thank you very much. There have been a number of questions that have come in about the Accelis system. That's the fully online educational system that the DOE has contracted with. This is a long one and it's addressed to all panelists. Excuse me. One of my biggest immediate concerns is the overt and covert racism in the Accelis system, especially but not limited to social studies lessons. I continue to report to DOE and my children's teachers, 4th and 5th graders, but I did not see any systematic acknowledgement or discussion of how to make changes or how to offset these risks. The principal refers comments to the teachers who are overworked and ultimately powerless to DOE's decisions. And we absolutely love and support the teachers, it's in parentheses. Our parent update yesterday was that second quarter would be used to evaluate new programs and platforms that they may consider using for the second half of the year. As a parent, researcher, or clinical psychologist, and this year an elementary school teacher, I'm at a loss for how to bridge the gap between what is happening and what should or could be happening. So I'm going to throw that out to the three of you.
I can share what I'm aware of regarding Accelis. It seems to be in the elementary, from my personal observation, it seems to be issues within the elementary level. In the middle and high school, I think the issue more so might just be on rigor. So the middle schools and high schools should be adding extra things that the students can do to support their education. In the elementary, along with those issues that have come up, I think the Accelis program needs to be, writing needs to be added to that program, and that's just my personal opinion. So hopefully schools in the elementary are supplementing that Accelis system. With regard to the racism that was brought up, I do know that district resource teachers have been tasked. I haven't actually seen them do it, but from what I've been told, district resource teachers have been tasked to go through the program, to look for those things and report directly to Accelis to get those things fixed. I believe there's a DOE phone number too, and sorry I don't have it, that parents can call to let us know about it, and we'll work directly with Accelis to fix those issues. And I've also received emails and videos from Accelis. They're aware of some of the issues that came up, and they either share that it was from some previous case, or if it is something they're asking parents to call them directly, and they'll look into it and fix it.
I'd like to note that, oh, I'm sorry.
Go ahead.
I'd like to note that in addition to trying to deal with problems with the Accelis system, I think it's critical that we invest in using the biggest part of our education budget, which is our teacher salaries, to create our own online education program. We have talented teachers who can provide much better programming than any of the curricula, Acellus, K12.com, any of them. And we have teachers who can't go into the classroom. We should be investing in the right learning management system, the right media development support for teachers, and we should be respecting our best teachers and getting their lessons recorded so that they can be shared throughout our district, knowing then that they will meet our standards and our learning objectives in our local environment. So I hope that we do this. I think, ultimately, the most important thing in our students' education is our teachers. And if we can leverage our own teachers, I think that's best for Hawaii and our children.
I completely agree with that. I think that Acellus, I don't know if there's any fixing, to be honest, around it. There's so many different issues. One question I actually have, I know I'm a panelist, but I have a question for Dr. Kuba is, do you know, is there a way for parents to actually disinvest from their decision to use Acellus and go another way at this point? Because I know that there's been mixed messaging around that to parents across the state.
I think on that one, that would be like a school level decision. There's two sides of the coin where I know another issue that came up is that it seems that like one school is different from the others. One teacher, I saw that one classroom is different from another classroom. And from a parent's perspective, I understand that that can be challenging, especially when you have multiple children. As an administrator, I actually appreciate that because before it was one size fits all and this is how you do it. And a lot of times for my school specifically, we'd get the short end of the stick and our kids would be suffering. So I appreciate the fact that I can make decisions that are best for my students. With that being said, I come back to Acellus where in that sense, if a parent wants to speak to their administrator, that's kind of like a school level decision on that.
Thank you.
Thank you. And then another related question is, has anyone reviewed, excuse me, the social emotional learning curriculum in the Acellus program? And if so, do you find it appropriate?
I'm assuming that's for me. I haven't specifically, but for the middle school, it is an option for a wheel class or what do we call it? It's an extra class. So I know that it wasn't necessarily the SEL program, but a student had trouble with actually a STEM course, this coding course. But at the school level, we have the ability to switch courses. So the parents simply called us having trouble. So we changed the student to a different elective course. So, that applies to an SEL program or one of the classes if there was issue with that.
I've only heard rumors from other people that have seen it, so I don't feel confident in saying whether, speaking to the quality of Acellus, but I do know that there is an immense amount of really high quality SEL programs that are available to families. Just a ton of them, and many that are offering them completely for free. I can get that too. To Claire, I can get that to you, like a list of a bunch of these sources from them.
Fabulous. Thank you so much.
A number of those are listed on the Panorama Education dashboard.
That's right.
So that link, which is already up on our website, people can just click and get there. I'm also working on an archive for the organization Seeds of Peace. And we are offering access to an archive of SEL programs and peace building programs. And I'll put the link to that up as soon as that archive is ready in about a week up on our website as well.
Great. Thank you, Deborah. Okay, a couple more questions. One question, and again for, I guess, any of the panelists, I think students should not return to in-person schooling until a vaccine is developed for COVID. What are your thoughts?
I'll jump in and then maybe Reid can add on to it. I just wanted to reiterate Josh Green's comments, I think were relevant. He mentioned that he thought that the mask wearing is actually going to help us and it's going to be more protective than the vaccine. So I also think that what he was mentioning in response to a question by a call-in question about the location. So of course, those of us in Honolulu are at much higher risk than somebody on Kauai. And so I think it's gonna be, you know, judging your community and your individual household. You know, if you live with somebody who's vulnerable, if it's a grandparent or a child or any of us, then, you know, then it's different. So I think each family has to make that kind of judgment to decide when would be appropriate for them to come back. Reid, go ahead.
I think I can echo that. We've been trying to be as supportive as possible for individual families. And that was the challenge in such a short amount of time. For us, it was less than 2 weeks because we were ready to come back face to face on August 17th. And then just things changed, and within 2 weeks, we needed to learn how to do distance learning and provide an online option because we understand that there are different families have different needs, they're on the different level of wanting to come back and not wanting to come back. So we're trying our best to accommodate all the families in their individual situations.
Thank you. And then one last question, Reid, this is probably best directed to you about the needs of special education students during this time. What are you doing at Jarrett? What do you see happening across the system to address the special needs of these kids?
So as administrators, we have the flexibility and actually encourage to bring those special education students in, especially really high need students, bringing them face to face. But like I said, for my campus, there's like 3 students who I really want on campus, but their families are choosing to keep them home. So we respect that. We still call them and try and encourage them, but we respect that they want their child at home. So then the second question would be then, if they're at home, how do we still provide that education? And so we do it in various ways. Some are able to do it through distance learning. Some need work packets that the school prints up and sends home. Others need calls weekly to check in and update. But it is a challenge to, because for us, and especially for special education students, I believe that, you know, getting to school, interacting with their teachers, interacting with each other, their peers, really helps them. So it is a challenge in this distance learning platform. Yeah.
Thank you.
There is the opportunity to come back face to face. So, but you need to work that out with your individual administration as well as the SSC.
And just to follow up to that, I know that you have you serve a large immigrant population in Pololo. What's the situation with English language learners at your school?
So for us, we know which students can be mainstream within the classroom, and yet there are others who are here from, say, China. I have about 5. They're called NEPs, non-English proficient. So I have about 5 of them, and we've actually contacted parents, and we have them on campus. So, you know, we're teaching them alphabets and we're teaching them, you know, their vocabulary, but they're actually on campus every day from 8 to 2:35 and getting individual help and group help.
Okay, great. Thank you. Thank you. Well, I know that Dr. Martin needs to log off, and we really, again, appreciate so much the time and preparation and sharing with us all that you've all that you do and all that you'll continue to do. We're going to just have a few minutes because this is kind of our annual meeting and our opportunity to explain to folks a little bit about the history of and the present and the future of Parents for Public Schools. So for those of you who can stay for a few minutes, please do that. I'd also like to give a shout out at this time to Chelsea Molina, who is the tech brain behind today's annual meeting. We're very grateful to Chelsea for everything that she's done to keep this rolling online. And Chelsea, can you start the slide presentation? Here we go. Thank you. So, Parents for Public Schools, the family voice of family education in Hawaii. We emerged from the Furlough Friday crisis in 2009, which many of you who lived here, if you lived here through 2008, 9, 10, you'll remember this. Basically, the state budget was balanced on the backs of all Hawaii residents, including Hawaii's children. And there were some of us that just thought that this was unconscionable and unfair. And so we organized and founded a group called SOS Hawaii to try to bring the voices of family and children into the debate. And we fought successfully to end Furlough Fridays for the second year. And these were some of our early efforts. This was the occupation of the Governor Lingel's office back in 2009. And there we were, again, recognizing that family voices had been left out of the conversation about public education. So it took a long time before we escalated to get to the point where we occupied the governor's office. But that's in the end what we felt that we had to do because we weren't being listened to and the kids weren't being listened to. And again, Furlough Fridays impacted children in public education, about 10% of the state's population, and their voice needed to be amplified through our own. So SOS 808 kind of evolved or transitioned into Parents for Public Schools, which is a 29-year-old nonprofit organization based out of Mississippi. And can we go back to go forward to yep, there we go. We officially became a chapter in 2011. There's a lot of autonomy, but the advantage to being a member of a chapter of Parents for Public Schools is that we have phenomenal national resources and we can share our stories and learn about what's happening in other states where, of course, across the United States, there are grave problems with public education. So, our goal is really to, well, actually, I'll wait to that. We'll get into our mission statement. So currently, there are 12 chapters in 9 states. And again, the focus on educating, engaging, and mobilizing parents of public school students. Thank you. Here's our mission statement. To engage parents, students, and community members across the state in supporting enriched and quality public education through effective communication between families, communities, and schools. 2, greater awareness of educational policies and practices. 3, community involvement in education and decision-making that promotes school support, improvement, and student achievement. And lastly, to help provide accurate media representation of public education. We want to show the good as well as the challenges in public education statewide. And all of us on the board have had skin in the game or still do as far as children in the public education system. We partner with a number of organizations throughout Hawaii. The College of Education has been a huge supporter. HEA has been mentioned today, the Hui for Excellence in Public Education. Hawaii Schools Federal Credit Union has given us a grant. The Community Engagement Office of the DOE, the Hawaii Children's Action Network, and the Hawaii After School Alliance. Goals and accomplishments. I should say that Chelsea Molina is our school transition night coordinator. That is a very, very kind of part-time position. We don't have any full-time staff. We are all really a volunteer-based organization, and we encourage participation at our monthly meetings or through Facebook engagement or through our website. One of the things that we've been focused on is the school community councils at schools. And again, I think we all planned on doing more with SCC activism this year statewide to explain to people what the school community councils are and to kind of have that as a program focus. With COVID and the other issues that that parents have been facing this year, we've set that back a little bit, but it's still very much something that we are focused on. Trying to, again, educate. The school community council is something that's required at every school under state law. It's something that we feel is really underutilized and not really understood, and a really fabulous, if it's used correctly the way it was originally intended, it's a great way for parents and community members to be directly involved in their schools and the policies, the educational and other policies of their schools. And there's more information on our website about the School Community Council. Vanessa Ott, one of our members, is very passionate about school community councils, and so are our board members. And this is something that you'll be hearing more about our work in the coming months. We also have done middle and intermediate school transition events, realizing that a lot of people were leaving public schools after elementary school because of this kind of great fear unknown about public middle schools. And so we have organized transition nights that have gone on at different schools throughout the state of Hawaii to bring elementary school parents into middle schools so that they can kind of demystify the public middle school in their district. And I think it's been very effective also explaining what's going on in the adolescent brain here, what's going on in middle schoolers, what to expect, and again, to really encourage people to consider keeping their kids in public school all the way through high school. And so that's been one of our programs. And then multiple surveys, and again, our board member, Deborah, has been spearheading a lot of the work on the surveys. And then we have some excellent people on our board who are in the Department of Education and really great at analyzing data. Corey Rosenlee from HSTA is there, as well as Deborah Zeisman, another community education leader. And so trying to get the work that we're doing, the amplifying family voices into the media and the larger local community. And so the survey that we had was open from August 25th until September 8th. That Lois gave a brief recap of at the beginning of our annual meeting. And again, there's more information about the survey on our website. Different ways you can be involved, definitely, by engaging with your school community council. Reach out to us. We have information also on our Facebook page about that. You can assist with grant writing and fundraising. If you have special skills that you are willing to share with us, we would welcome those. help with publicity and social media, with policy advocacy. Encourage your family and friends to become members. We have well over 1,000 members statewide. Their membership is free. We don't harass you. There's usually a monthly email newsletter that comes out. And again, we're active on our Facebook page and other social media. It's really just tips to get involved and letting you know some of the current issues that are out there. And again, it's not a hard sell, but we'd love to get as many additional members as possible statewide. It really helps us when we're talking to legislators and other folks to say that we have over 1,000 members representing over 1,000 families in Hawaii. And then if you're interested in becoming a board member or come to our meetings are open, reach out to us. There's again, always information on our website about how you can log in. And one of the great things about doing the board meetings online right now is it really encourages and makes it much easier for neighbor island participation, which we want to be. We are in many ways an Oahu heavy organization, but that's not our intent. One of our board members is an educator and activist on the Big Island. It would be great to have someone from Kauai and Maui join us as well. I'd like to just, I guess Lois is our president. Lois, is there anything else that you would like to add, or any of our other board members before wrapping up? Looks like we covered it. Okay, well then I'd like to close out the meeting. Thank you very much to all of you for joining us today. We hope this was helpful. We really appreciate, again, the participation of our panelists. And we wish you all well, health and safety, and calm in the really challenging days and weeks ahead. And we will get through this together. So that's it. Thank you all very much for joining. Have a great weekend.